Oh, we're not live?
We're now live. We are now live.
Okay.
On
Okay,
my
guys.
YouTube, it still says waiting for NickVideos, bro. I don't know what
No, we're all live. It'll update in a sec. Don't worry.
Okay.
Hello, everyone. Actually, Nick, you do the intro, man.
Okay, hello everyone. It's NickVideos. Y'all know who I am. The freaking legend. I brought these two here today for an awesome debate on Medicare for all. I think that's all we're discussing. We might be discussing more. Who knows? We will see what ensues from this debate tonight. I'm hoping to keep it bipartisan on my end. I'm not going to ask any loaded questions or anything like that. The only time I will interject is if somebody starts interrupting, or we get running in circles or something like that. I'm going to be as least biased as possible. As y'all know, I'm very anti-Medicare for all, but for the sake of this, discussion, I'm going to be unbiased, and you will not see anything like that on my end. We have political Bhanti right here. As y'all know, I'm the freaking legend, and we have GabiKatharina, the only leftist on the app that I tolerate and enjoy talking to. So yeah, I'm looking forward to this discussion. I'm going to flip this remote on who does their opening statement. So, Gabby, you can pick a side. Which side do you want?
I'll do the buttons.
Okay. And it landed on this. It was like this on the ground. So, Audie, do you want to go first or do you want to go second?
Yeah, I'll go first.
Oh my gosh, my light almost fell. All right, go ahead.
Okay, thank you for doing this, Gabby. Good stuff. It's going to be fun. I come to this debate acknowledging that our healthcare system isn't perfect. Okay, we both know that. It's not just not perfect; it's actually quite flawed. And I'm sure we're going to get into that, and I think we both agree on that simple fact. So my case against Medicare for all is not necessarily a case against any healthcare reform. It's just that I have a different solution. So my 5 points, I have 5 simple points. First, healthcare is not a human right. And I know this might paint me as a bad person, but there's logical and factual evidence backing that up. Secondly, Medicare is much more costly than the private options from a federal government perspective. Third, deregulation, not more regulation, will lead to a decrease in prices rather than increase the national spending and debt, which will be passed on to future generations to pay off for the rest of their lives. And fourth, Medicare is a terrible system and fraud is committed on a regular scale. And finally, Medicare for all stifles innovation, competition, and steeply decreases the quality of care for patients. That's it for my opening statement. I'm sure we'll go into more detail later.
All right. So for my standpoint, I am of the belief that everyone is entitled to the human right of healthcare to embetter their health and to embetter their quality of life in America. Right now, we have 37 million Americans who don't have health insurance, as well as 41 million Americans who have inadequate access to insurance. And we spend more on health insurance per capita out of any country, despite not having the best healthcare. And I think Medicare for all would offer everyone a equal opportunity to get the healthcare that they need to increase their quality of life, period.
Okay. So can we just get into rebuttals now?
Yeah.
Okay. So I want to pose a question to you. Where does that entitlement come from? Why are people entitled to healthcare? Healthcare in the general sense, not emergency healthcare, because we all know they already are entitled to emergency healthcare.
Right. Well, I mean, improving on our quality of life, improving on our general health. We don't have the best health statistically compared to other countries, and we don't even have like the resources to embetter our health and embetter our systems. I mean, and also our private health insurance, those inflation rates have risen higher than what Medicare has risen over the past couple of years and even decades.
Okay, so my question to you now is, you said we don't have the best healthcare in the world. So are you referring to the healthcare system itself, or are you referring to the quality of healthcare?
To the healthcare system itself.
Okay, great. So I'm going to get into my first point because I think at this point we're ready to get into that. So my first question before I get into this, you consider healthcare a human right, correct?
Yes.
Okay. Well, according to the Universal Declaration of Human Rights, the UDHR, which is basically the global standard of human rights used by the UN and even more global scale organizations and national organizations, there's no declaration or article saying that healthcare is a human right. And I know you may say the UDHR does say that life is a human right, but that actually means life in the sense that you can continue your life on a regular basis on a normal scale, but not being able to pay for healthcare can be traced directly back to personal economic situations. Do you acknowledge that as fact?
Oh, yeah. Well, I mean, most people can't pay off their debt, which is the issue.
Okay, so you're aware that the majority of hospitals actually, for very low income people that they know are never going to be able to pay back their debt, actually do write off the debt, right? Hello?
She's frozen. Guys, this is not a clip. She just like froze on what's going on.
Hello, Gabby. Oh man, we're just getting into it. Gabby.
Guys, this is not. Oh no! What happened? Hold up, we got to take. Let me call her.
Did my internet just cut out?
There we go.
Yeah. You're back.
Okay.
You're back.
Did my internet just cut out?
Okay.
Yeah.
So,
okay. Sorry about that. My internet's like being really weird lately.
You
Sorry.
like froze for a second.
Oh wait,
I was
can you rephrase your
whoa,
question again?
did he just like?
Yeah. Okay.
Yeah. Can you rephrase your question?
Yeah. So my question is, so first of all, you acknowledge that according to the Universal Declaration of Human Rights, healthcare is not a human right. You said yes to that question. So my next question that I think when you cut out was, that for the majority of low income people, that hospitals definitely know, and insurance companies, well, the hospitals are the ones that write it off, but that hospitals definitely know that when someone can't pay it back, usually it's written off, right?
Right, but they're still going into increased amount of debt, and the insurance companies can choose not to cover that debt.
Well, the hospitals write it off. That's the difference, not the insurance companies.
Right.
Yeah. Yes. So, yeah. And then my next thing, you were referring to the Medicare inflation rates. I've heard this one before about how Medicare is actually more cost effective than private health insurance, correct? For on a federal government perspective, right?
Yes.
Okay. Well, every single study so are you using the Yale or U Chicago study or some other academic institution studies or hospital studies?
Yeah, I can pull it up.
Yeah, please do. I just want to make sure I'm referring to the right studies.
I'm just pulling it up. Where is the source? I believe it is the. Hang on. I believe it's the Yale study.
Okay. So the thing with the Yale study, right? First of all, those account for minimal amounts of care, minimal care, right? So when you're doing these private health insurance studies, usually, first of all, there's an economist involved. In the Yale study and the U Chicago study, there's no economist involved. It's all healthcare professionals, not a single economist, not a single economic journal in this country actually says that, Medicare for All is cheaper. Actually, would add $3 trillion in federal spending, which is actually almost doubling the budget. I think it's around 40% increase in the budget per year. So these studies account for minimal amounts of care meaning very low care, basic care, not actual surgeries or other things, like a fairer spending cap, right? And also there's not a single economist involved in these studies. So would you agree that those studies might be invalidated through those means?
Right, those ones. But then I also use the Mass Amherst and Emory and then the PLOS study as well.
Yeah, I have every single one of these written down here. Every single one of those academic studies, not a single economist and not a single economic journal or academic writing from the economic perspective agrees with the notion that Medicare for All or Medicare in general is cheaper from a federal government perspective. So I acknowledge that you're saying that, Medicare for All might be cheaper for the individuals, but over time it really adds up and it's a debt for the people to pay off. But I think that's it for my rebuttals to your opening statement. And I want to let you get into it.
Yeah, but also with the UMass study, it was written by 6 economists and peer reviewed by 11 people. So when we're talking about Medicare for All, the need for Medicare and the demand for it would increase by 12%, and the cost would increase by 19.2%, which does seem like a lot, but it would lead to a decrease in net costs, which is done by one of those studies, the Mass study. But when we're talking about healthcare and we're talking about health insurance, we're talking about whether or not it's a market or not. And we can probably agree that there is some sort of market to be there, but not within healthcare. And I think that's where we disagree. I would say that the free market that we can have is for hospitals instead, to have those privatized, whereas with Medicare, it could be privatized. And especially when we're looking at private insurance, with the VA, which is like Medicare as well, 90% of the veterans who use the VA and use those hospitals would refer the same service to other veterans. And those hospitals outperformed privatized hospitals in most studies that they did. And this was in a study by Dartmouth, I believe.
But you realize the VA is a crippling system. massive amounts of debt and crazy waiting times. And secondly, so you said we could have a free market for the hospitals, right? That's what you just said, rather than the
Yeah.
insurance itself. Okay. Well, why not kind of change the game a bit and kind of do what some other countries do? So if you look, which is deregulation, as I said in my opening statement, deregulation is the key. So if you look at the LASIK, are you familiar with the concept of LASIK eye surgery?
Yeah.
Okay, so the LASIK eye surgery used to be heavily regulated by the federal government, and insurance companies were required to cover it, right? At this time, when the insurance companies and the surgery itself were highly regulated, at this time, per eye, the LASIK surgery costs $4,000. But now, after the deregulation, you pay out of pocket. Well, that increases the competition, and inherently the prices go down. Now it only costs about $1,000 an eye. So net, that's about a $6,000 saving. So why couldn't we do this for medical procedures like different types of surgeries and things like that? That's my question.
Well, I mean, competition itself, it decreases the quality of care because you have all these people competing against each other to have, the best kind of care. And it doesn't offer a very suitable option for people, especially an affordable option. It actually increases the prices many of the time. But what were you saying?
I think it's actually quite the opposite. Competition increases the quality of care. So let's compare, a little thought experiment / comparison. Let's talk about Samsung versus Apple. Okay, so an iPhone versus a Samsung Galaxy S9. The iPhone 11 versus Samsung Galaxy S9. They're always trying to outdo each other, which is why every single year we're seeing new features and improved features of the other company's phones, right? This increases the quality and the features and the accessibility of these phones. It decreases the prices inherently. And I know the iPhone prices technically go up, but that's the price of the features. But like on average, it goes down, right? So it actually increases the quality of the phones, and it on average decreases the price of the phones. And I think we see that same effect. I mean, if you look at LASIK eye surgery, the quality of the surgery actually went up because there was always an industry standard, but people are always trying to outdo the other, which is why we have a market. So in the market, you can kind of shop around. You can shop around for the LASIK eye surgery. That's my perspective, which is historically backed. So I just don't see where you're getting that notion that competition decreases quality of care and increases prices. But if you want to elaborate on that, please do.
Well, like in regards to, insurance, when we're talking about competition, we're talking about how they're able to increase, drug price caps. So the cost of drugs go up a little bit more. Overhead goes up when we're talking about private insurance companies, whereas with Medicare, it's significantly lower. And with Medicare as well, this is covering like the basic things that everyone needs, like, checkups, basic vision, hearing, and all like the basic minimum.
Okay. Yeah. So this brings me to my next point. What if we erased the state lines on privatized insurance? So then we have a nationwide market. You can shop around for the healthcare. That means everyone in every state has to compete because if you didn't know, in states like Illinois and Indiana, there's like 2 insurance providers. There's 2. There's literally 2 outside of the public options.
Right. There's 2 to 3 per region.
Exactly. So what if we open the state lines and that forces everyone to decrease their prices because you're not going to go to the most expensive guy. Everyone's going to be trying to increase their quality and whatnot. If you could repeat the second thing you said in that, I forgot what you said. If you want to repeat that, that would be really.
Yeah, that right now the issue is that there's no price cap for these, medical prescriptions and things that people need for like pre-existing conditions.
Okay, pre-existing conditions. Well, insurance companies are required to take patients with pre-existing conditions already, and I acknowledge that. And I think that there should be more protections in place for those people. I will concede that to you because I agree that we need major reforms in that aspect. I also think we need price caps. I mean, we cannot keep increasing drug prices every single year. We can't keep increasing costs of care, which is why a free market and competition system would work inherently. If you look at LASIK, if you look at other dental work, there's tons of evidence that just aligns with that, and that shows that is the effect that would take place.
Right, which is, hang on, sorry. Could you restate that again? Sorry, I missed the end of that.
Yeah, I was going a little fast, so I kind of forgot. But I said that, inherently, instead of doing all this, I admit that, we need price caps on the drugs. Insurance companies shouldn't be able to just increase. But if we have a free market and a competition system, inherently prices will go down. And I think that would be a way more effective solution to the drug prices and to the insurance prices. I think what we really need to do here is tell the insurance companies, we're going to open this up. We're going to cancel the state lines. You compete all you want. People aren't going to go to the most expensive guy if they have the option to go to whoever else they want. That's my stance on this.
Right. So like if we have hypothetically, if we had the money to pay for a universal healthcare system, then why wouldn't we do it?
Well, we don't have the money to pay for a universal healthcare system. It would add $3 trillion in government spending every single year, $30 trillion over a period of 10 years. And the federal budget annually is about $4.1 trillion. That's about a 40% increase in the budget. So, I wouldn't necessarily say we have that money unless you want to increase the inflation rates. Like if you see with the COVID relief bill, we printed out $2.1 trillion in cash to circulate these checks. Our inflation rate is going to rise within 6 months. Our food prices are going to rise. The same thing that happened during the Great Recession. So unless you want to live in a country with inflation rates so high that when you put your money in the savings account, you're actually losing money, we really don't have the money. I personally am not a fan of increasing government spending by $3 trillion or 40%. So we don't have the money. And I think you misunderstood my notion. The government is not paying for a free market in the insurance industry. The government's not paying for that. They're just simply removing the state lines, and then the insurance companies can duke it out. So I think you a little bit misinterpreted what I said. That might have been my fault. So I just wanted to clarify that.
Yeah, I'm just saying that if we could technically have the money. I mean, especially in the way that Medicare was laid out in the proposal that was done. I mean, creating a 4% income-based premium paid by employees, exempting the first $29,000 in income for a family of four, which would raise $4 trillion over 10 years. Then we impose a 7.5% income-based premium paid by employers, exempting the first $1 million in payroll to protect small businesses, which would raise $5.2 trillion over 10 years. And then we talk about eliminating tax expenditures, which would no longer be needed under Medicare for All, which would raise $3 trillion over 10 years. And then we raise the top marginal income tax by 52% on income over $10 million, which would raise $7 billion over 10 years. So we have numerous options to actually raise the money.
Yeah, but that only gets us to 15 trillion over 10 years. We need 30 trillion. We're going to get the other 15 trillion from, because the things that you just named were massive changes to the way the country works. And maybe if that's the only way we can pull out $15 trillion out of our ass, that's the only way that we can do it. But there's 15 trillion more dollars. There's another $15 trillion gap. So those are all the changes that we can really make in a sensible way, right? And those might be sensible changes. Those are the only changes we can make in a sensible way. Where are we going to get the other $15 trillion from? That's my question.
Let's see. There's like other options.
Because you can take all the money from all the billionaires and combine it, and you still wouldn't have enough.
Right, but we would still be able to. That would be by, if we streamlined things like the FDA, things like that, to raise more money through exporting, drug prices to overseas, like in the UK and areas like that, especially.
So you think that we can export enough drugs in 10 years to get $15 trillion? And what kind of streamlines to the FDA would generate $15 trillion? I'm sure that streamlining and increasing efficiency in the FDA would give us a couple billion back, maybe 20 billion, 100 billion. But I have severe doubts that those two things combined would net $15 trillion. Also, you can't ignore the fact that we don't really manufacture that many prescription drugs in the U.S., especially right now. We can't even meet the need of our own people. How are we going to export $15 trillion worth to the U.K. and France and whatever else?
Right, but that's just an option. That's a thing that we could do as a part of, Medicare for All. It is streamlining. Is an option. Okay,
so let's say we streamline the entire federal government and we export half the drugs that we make in the country right now, and we bring back some. Let's say that gets us to $20 trillion, right? Because realistically, that'll probably raise a couple trillion. So I'm going to give you the benefit of the doubt, and I'm going to say that raises $5 trillion. So now we're at $20 trillion. We need $30 trillion. So what about the other $10 trillion?
Well, we have, let's look at my other sources.
Hold on. Someone said spend less on the military. We spend like 65 billion on the military.
No, we spend like 850 billion on the military.
850 billion. Okay. Yeah. My bad.
It's still not
even close.
We spend a lot of money on the military.
Yeah. Well, Trump proposed a $1 trillion military budget for next year, which I disagree with.
Yeah. No, that's a horrible idea.
Yeah. That's bad. No bueno.
Okay, so what about the other 10 trillion?
Hang on. I have the exact numbers here. Then we have options like taxing capital gains at the same rate, which would raise $2.5 trillion. We've been enacting the 99.8% Act, which would raise $336 billion over 10 years. Enacting corporate tax reform, which would raise $3 trillion over 10 years. And $1 trillion would be used for Medicare for all. Yeah, and then using $350 billion of the same amount raised for the tax on extreme wealth to finance Medicare for all.
Okay, so we're at 25 trillion, but here's the thing: if you look at the capital gains tax and then the 52% marginal tax, I hate to break it to you, but these billionaires, when we get to that point where we have the equal rate of capital gains tax and the 52% marginal tax over income over $10 million, their money's not going to be kept in the United States. I hate to break that's just how it works. And you can do whatever you can to stop them. But realistically, there's going to be so many ways to get around it. And that still only gets us to $25 trillion. So I think the point is true that we really can't afford it without a strong increase in government spending. And I don't know where we're going to get that money. So I'd like to hear some of your other arguments, because I think this point's a little baked over. I think we've been talking about it for a while, and there's really no way to fund it. So what are some other reasons that you would support a Medicare for all?
I mean, we have, I believe it's 40,000 people who die per year of health from lack of healthcare and lack of health insurance.
Okay, so it's actually not per year. Also,
and
that
we aren't.
Go ahead. Hello.
Oh, we lost her again. Dang.
Jesus Christ.
Golly.
Come back, Gabby. Gabby, come back. There she is.
I'm here. Wait, what's going on?
Okay, you're back. We couldn't hear you for like the last 2 minutes. So go ahead. Damn, bro. She's gone again. Yo, Nick. I think she's gone, bro.
No, she's not gone. Her ass just fucking out.
Oh, there she is.
It just like keeps shutting the bed. It's making me anxious. Like, when's my Wi-Fi gonna cut out again?
No problem. So yeah, your study, first of all, the 40K a year is super inflated number. Secondly, the study that I hear commonly used, you might have made a TikTok about it. I know that leftist girl has made a TikTok with this study, and most leftists do. And it's a good study because most people wouldn't read into it as much as I did. The 60,000 people who died from not having health care or being underinsured, that study took people who died from 1998 to 2008. They took people who didn't have insurance at the time, but could have had it, but they didn't because there's no mandate which required you have the insurance. And they could have died from any cause, not just lack of healthcare, but the people surveyed, they could have died from any cause. And in this study specifically and others, it would have counted as a lack of healthcare. Well, when you crash your car, that's not a lack of healthcare. That's just you crashing your car. So that study's super invalidated. But I think he used a different number. I think he used 40,000. So if you want to explain that study to me, I'm more than willing to listen.
Yeah. Well, but I also want to kind of go back to my other point is that we already spend money on healthcare as a government. So we already have the $30 trillion in spending.
But we don't spend $30 trillion a year on.
But we already have it.
Let her talk.
But we already have it. So current federal, state, and local government spending over the next 10 years is projected to be a total of $30 trillion. So we already have that money. And the revenue that was offered or thrown out there by Bernie was the 17.5 trillion. So a combination that would get us to $47.5 trillion.
You realize that Medicare is a federal government program. You can't count state and local. So I assume the majority of that's invalidated because the federal government only spends $4 trillion a year on everything. So, over 10 years, 4 times 10 is $40 trillion
for everyone.
That's like total for everyone, right? But Medicare for
all
is
total. Yeah.
Okay, yeah, but Medicare for all is for everyone. So, we get that $40 trillion over 10 years. That's what the government spends right now on everything. So now you want to take $30 trillion of that. Screw every other government program. Let's put 10 trillion on all the other people's needs, and let's put 30 trillion into healthcare. Do you think the tax increases, which would be literally placed on anyone with over like 29K a year, slight tax increase, do you think everyone in this country spends enough on healthcare to justify maybe a $600 tax increase? Do you really think everyone spends that much a year? What if we spent money and made preventative healthcare programs, telehealth or whatever, checkups, free checkups for low-income people, maybe people who make under 50K or 45K? What if we did that so we could prevent larger health issues by preventative care? What if we did something a little bit more sensible rather than wiping out 30 trillion out of the 40 trillion 10-year budget of the government?
Right. I mean, that's the ultimate goal, is to offer better options to, decrease the issues that arise later. But also, we can't predict what's going to happen. I mean, you could be in perfect health today, and then the next day need something very important that you needed to survive.
Yeah, no, I totally get that. And I truly believe that, people, charities, hospitals, they should do what they can to help people in need, especially in situations where their life could be taken away, especially people who are in low income and poverty and situations that aren't ideal. But my question is the tax increase on the average person? So should the personal economic decisions, and I know there might be other factors that play into someone being low income, but should the personal economic decisions or situations be the responsibility of everyone else in the country? That's my question. Because not everyone spends a lot of money on healthcare every year.
But I mean, we're already spending money for the embetterment of other people. We already are paying for other social or social programs, that we all utilize, that we all use as a community.
Well, I mean, look at Social Security. We've been paying. Oh God. I put up I did not mean to click on that. It was some like racist. Okay, anyway.
Why did you click on that?
Dude, I didn't know. Dude, my mouse just like my mouse whenever I was trying to go to my notes and scroll, but it accidentally clicked on that. My bad. But here's the thing. So we already put in money into social programs, right? Well, the government sucks at spending our taxpayer money. Let's look at Social Security. We have been putting money into Social Security ever since you got your first job, for our entire lives. Our parents have been putting in Social Security money maybe for 20, 30 years, ever since they've been working, ever since they've been paying taxes, whatever. It's now a giant pile of shit slush fund. There's literally no value to it. They're thinking of increasing the age once again. We're never going to get that money. The reason the age was 65 in the first place when this was first started is because most people didn't live past that point. They're considering an increase again. So do we really trust the government? So we already have these social programs, which are a massive failure because it's the United States government. We suck at spending money and using the taxpayer money. So let's say we raise another 25 trillion a year and give it to the government. Do you really think it's going to work out well? Because the Government Accountability Office, which is basically the oversight of the entire federal government, $50 billion a year went to improper fraudulent payments last year in Medicare. Medicare itself, the committee that runs Medicare, acknowledges that 10% of payments alone are not proper payments. So, the government really does suck at managing our money. They can't verify fraud. So do we want to give this money to them, or do we want to create a free market system where we increase quality of care and decrease prices?
But with increasing quality of care, we can privatize the hospitals. It's not a reflection of the healthcare. Because if we did Medicare for all, the quality of doctors wouldn't change.
Yes, it would. The quality of doctors might not.
It wouldn't, though.
Might not, but healthcare overall, the quality would definitely change. Let's look at this. So we have maybe tens of thousands of hospitals in this country used to operating on a specific budget set by the current income level, which might fluctuate slightly if we go to a fully free market system. But they're used to a current income level. So we take these hospitals who are paying the doctors, nurses, janitors, physicians' assistants, surgical assistants, paying for the ORs, the medical supplies, whatever else. And we say, hey, no, the government's taking over healthcare, and guess what? Your budget's going to be cut in half because, the funding is just not going to be the same. The amount of money that they're getting is not going to be the same, and I don't think it should be the same. I think it should be slightly decreased by a free market system. But anyway, the hospitals will not be able to operate So then, you know what we're doing? We're cutting out supplies. We're cutting out the size of the hospitals, decreasing the medical resources in the specific region in which that hospital serves. Medicare for all would significantly decrease the quality of care. Another aspect of that, waiting times. So in Canada, it can take up to 6 months to get a PET scan unless you're literally about to die. In the US, it takes 6 hours. You go to the hospital and say, hey, I need a PET scan. Usually they'll get you in right away. If not, they'll get you in tomorrow. So yeah, quality of care severely decreases. And I think it's super unfair to tell people, hey, someone else's health problem is way more important than yours. So you're gonna have to come back 6 months later. We don't want that. We see these waiting times in the NHS in England. We see it in Canada, Denmark, Finland, and every other country that has socialized medicine. So quality of care, waiting times, they all get screwed.
Right. But the issue with Canada, though, is that Canada is a queue system. So with Canada, and you're waiting in line, you're waiting in an actual line, like an actual physical Rolodex of people, and you can't cut in that line, and you can't even go to another area in the country, even if they can offer you that same service and they have openings. They can't do that. That's not what I think is the most productive way to do it. I think we can both agree on that. Denmark actually has a system that they have in place where they have a cap limit on the amount of time that you can wait for a actual service. And when they first introduced this, I believe in the early 2000s, it was a 2-month cap on waiting to get services. And then once that time was up, you could go to another place. But then they later lowered it to 1 month, and that seems to be very effective. But even so, we still wait here. We still have a wait list issue here as well, and a waiting time issue as well. I mean, sometimes it takes even a month to get seen at some of these big hospitals.
Okay, I get that, but at least we have different options. So you said 1 month. So you're saying that some people's medical issues might not be as important. So, you're going to wait for 1 month. And I'm going to use simple things like a PET scan and x-ray. What might not be severe to you, Gabby, might be very severe to me. Me breaking my arm and wanting, that's actually a different scenario, but me wanting an x-ray might not be a big deal to you because you might have a brain bleed, okay? But me wanting an x-ray is severe to me. And I think I should be able to go in and get the x-ray the same day. And in the majority of the cases in the US, please let me know if I'm wrong. I don't think I am. Actually, I'm almost 100% sure I'm not wrong. You can go in and get an x-ray the same day or the next day. You don't have to wait a month and you don't have to wait a month to go somewhere else. You can go wherever you want. And that's the key difference. And in Denmark, you said the waiting time is 1 month. First of all, you should not have to wait 1 month for an x-ray, a PET scan, or a CT scan, or anything else you need, to be honest. Now, I agree that some surgery waiting times are a little bit longer, closer to 15 to 20 days. I think on average might be 2 weeks for non-essential surgeries, which is understandable. But you shouldn't have to wait 1 month for that. And then if they can't fit you in a month, you shouldn't have to go and apply for another 1 month freaking waiting list in another place. I personally think that's very unfair. People who think that their injuries are severe, maybe other people might not view them as severe, but that really doesn't take away the validity of their injury or what they need. And that's another huge issue in how the quality of care really severely decreases with Medicare for all.
No, she's gone again.
Oh my God.
I'm losing my mind. This is making me
No,
so
you're back.
mad.
You're back. You're back. You're back.
Oh
You're
my
back.
God.
You're
I'm
back.
this
You're
is
back.
making me
You're
so
back.
mad. Oh my God.
You're back.
But anyway.
Wait,
Jesus.
did you hear what he said, or does he need to repeat himself?
No, I heard what he said. I think it just like weirdly cut out. Like, I don't know. Oh God. But either way, we're still waiting. We're still waiting in America. We're still waiting in wait times. And with our hospitals, I mean, the places that do have these long wait times are the areas that are metropolitan areas. And we can easily get rid of this wait time issue by allowing there to be more, what's the word? I believe it's assistance or...
So you're saying Medicare for all would actually help the waiting times? Because that's just not true.
I mean, but the system we have now still isn't as good as it could be.
Yeah, but there's other improvements that can be made. At least I don't have to wait a month to get an x-ray before having to get on another hospital's waiting list to wait another month. That's the beauty of it. And I agree, there's definitely some waiting times. It's definitely not a month for certain things. Maybe for a regular checkup, if you go to a very busy doctor, there might be. But, the beauty of doctors being such a popular field is because it's a respected field. And we're also taking away that when we go to Medicare for all. And that's important. We need the best and brightest people going into medicine. And a lot of times that's not the case. That's why we see hundreds of thousands of Canadians and Mexicans coming across the border legally, and Canadians coming across the border to get healthcare here, because we have the best doctors and we have such great systems. And I agree, you might have to wait a week or two, but it's not a month on month on month.
I mean, but also the percentage of people that are actually coming into the United States to get healthcare, I believe that was reported was 0.5% of the people that were coming to the United States. I believe it was 2017 when they were coming, was a very small number of people.
So you said 0.5% of the people was a very small number of the people? Where did Gabby go, bro? This time she left, bro, because she just left, bro. What? This is not an internet issue. This is not what happens. Gabby, come back. Oh my god.
If I was losing that bad, I don't know.
Bruh, where is she? All right, guys. It looks like
Just wait
Gabby.
for her to come back.
Yeah, please come back, Gabby. We really want you a lot. Gabby, come back. We want you.
Dude, my Wi-Fi is being fucking horrible, and I don't know what's going on.
We can't even see you in this thing, bro.
It looks like you just left.
I'm literally on it.
No, she's on it. She's on it.
Okay.
I'm here.
Hold up. Just leave and rejoin.
Leave and rejoin.
Okay. Fucking Wi-Fi. I hate it here. Okay. Let's see.
Bro, absolutely destroyed.
What?
Okay. Now is it working?
Yes, she's back.
Oh my god. I'm so sorry, dude. My Wi-Fi is like ass.
It's okay. You know, it's honestly fine. But so my question, you said 0.5% of the people is a small amount. Well, obviously 0.5% of anything is a small amount, but if you can elaborate on that a little bit more, please, that'd be appreciated.
Yeah, let me just pull it up, the actual thing. You can find it. Yeah, so about 0.5% of all air travelers entering the United States annually was 100,000 and 200,000 people. And that was their list of health treatment, needing health treatment for visiting the United States.
Yes. So you're saying 100,000 people is not a lot of people coming from a different country for healthcare?
Well, that's not like an extremely large number. Actually, there's so many people coming.
Yeah,
and they'd still be able to receive good health. I'm sorry.
Okay, go ahead.
No, I thought you were telling me to let him talk.
No, I said let her talk.
Oh, I'm sorry. But that's
like this whole debate's been like a lot of him talking, and then like you'll get like a couple of points. But like, yeah, go ahead and elaborate on what you were saying.
Yeah. I mean, we also estimate that people leave the country as well to get healthcare. So like at the same time that we have people coming in, we also have people leaving to get other forms of healthcare.
Okay. Are you done? Can I speak?
I'm done.
Lord Nick, may I please speak?
Yes.
I'm sorry.
Okay, so here's the thing. The reason people leave the US for healthcare, first, it's for really cheap, crappy surgeries, or maybe even not crappy surgery, but cheap surgeries in places like India. But to leave the country, you really have to have some money to get to these Asian countries. It's not cheap to travel. And it's nowhere near that 100,000 amount. And the other reason, which we might see large numbers, is people going to Mexico for prescription drugs. And I agree with you that we need to do something about prescription drug prices. In no way did I say we don't need to decrease prescription drug prices or put a market cap on the prescription drug prices. So, yeah, I mean, there's 100,000 people or 200,000 people, I forgot exactly what number you said, who are leaving their own countries to come here to get the best possible healthcare. If you look at cancer patients, we have the best cancer care in the United States. That's why people from all across the world come to the United States. But if we go to a public option, we're basically in the same boat as the rest of these countries, with populations, by the way, way lower than ours. Outside of China, there's really no country with as big of a population of ours that does this, and China has the resources because of something called #slave labor. Okay, so it's a completely different story. But if you want to keep going with that point, we can. Otherwise, we can go into something else. So
yeah, I mean, it's even so. Like the surgeries are still expensive, and people aren't able to pay for them. That's the issue.
Yeah, and I agree. Surgeries are expensive. That's the inherent nature of surgeries. So what makes more sense? Would it make more sense for everyone to take on the burden of the people who need the surgeries, or would it make more sense for it to be a free market system?
I think she's frozen again.
Oh, God. She's frozen again. Oh, she's back. Okay, cool.
You are an evil person.
I'm sorry. I'm so sorry.
No problemo. So what I was saying is, wouldn't it make more sense to have a free market system where these places are competing to have the lowest cost surgery?
I mean, yes, but that's up to the healthcare insurance. It's
Well, actually, the health insurers wouldn't be the ones competing. They'd just be paying off whatever so basically the way the free market in this healthcare sense works, and this is what happened with LASIK and some other dental surgeries. What would happen is that the hospitals would compete with the prices. They would have pricing on every surgery, on whatever else you need. The hospitals would compete with the prices, and then you have your insurance companies who cover those prices once determined. So then you're really taking out the power of the insurance companies, which basically have like large monopolies on these things. You're taking out the power of the insurance companies to set pricing, and you're giving the power to the hospitals, but you're making it so that they have to compete. They have to fight tooth and nail to get lower prices and higher quality. Because, Gabby, here's a question. If you had $2,000, your insurance was going to give you another $2,000. You had to get your appendix removed, right? The surgery costs $4,000. You pay $2,000 up front, and your insurance pays $2,000 up front. Are you going to go to the place that costs $6,000, or are you going to go to the place that costs $4,000 and probably has a little bit better quality of care?
I mean, you'd probably go to the one that is cheaper.
Exactly. So these are the kinds of effects we get with the free market. But when we get to Medicare for all, the difference is maybe the costs are a little bit cheaper, but we're adding and spending in debt. We can barely afford it. Maybe the costs are a little bit cheaper, but your quality is equally shitty among all the hospitals. But why not have them compete? So you can have great ones, you can have bad ones, you can have cheap ones, you can have expensive ones. You give an array of options. People can go to what they're comfortable with. What's wrong with that?
I mean, there's nothing wrong with the matter of the hospitals. I mean, the issue is that when we're looking at hospitals in themselves, as I said before, the hospitals that are owned by the government, so like the VA hospitals, those themselves outperform private-owned hospitals every single time down the list.
In what sense? In what sense?
In regards to recovery times for life-changing illnesses like heart disease, and we have pneumonia. So it's like that they scored higher. Let me pull this up. Yeah, the study compared 30-day risk mortality rates for 4 common diseases: pneumonia, heart failure, COPD, acute myocardial infarction, and their safety precautions at these hospitals. VHA hospitals are likely to provide the best in local care market and were rarely reported to underperform.
Okay, so a quick question for you. The VA, first of all, you realize that the VA, most of the time, because it's so overflowed and debt-ridden, that now it refers people to hospitals. Also, my other question about your study, how many hospitals and how many VA clinics were compared? That I'm curious.
I believe it was 308 over 270 regions, I believe.
308 VA clinics or 308 hospitals?
Yes. Let's see if it'll load because the internet is being shitty. My phone too. See which one loads faster, because my internet really loves me today. Oh my god, why is it like this? My internet is being really shitty, but I believe it was 308 different regions, hospitals per region, and they didn't find much disparity between the actual care in the hospitals. They actually they scored the same or outperformed them.
Great. But you realize the VA is debt-ridden, has, is overflowed, and the wait times are insane. So what if we wanted, so let's say we wanted that safe and also, by the way, the VA is now referring patients to hospitals outside because they're so overflown. That's actually a Trump policy that they're now legally allowed to do that so that our veterans can get the care they need for whatever they need to get done. But you realize, what if instead of having all these different hospitals and whatever, we do the free market? So now they're competing. Let's say the VA is the standard of the highest quality of care. Don't you want these hospitals to improve their care and get to those points? Would you agree? Yes, you do, right?
Well, yeah, I would agree with that.
Okay, great. And you also want them to decrease prices and be affordable, right?
Yeah.
Okay, and you realize $30 trillion over 10 years is not affordable, correct? The VA is very different because there's not 300 million veterans, correct?
Right.
Exactly. So it's a completely different scale, and it's a really bad comparison. And I really, I get the argument. It's a good one. It's a good one if used correctly, and I believe you used it correctly. It's a good argument. But the thing is, the VA compared to the entire population of the United States, first of all, the VA costs way lower to run than it would cost for 300 million people and a boatload of government-run hospitals. Also, 300 million people in a healthcare system is incomparable to maybe a few million. Okay, you just can't compare the two logically. You just can't compare the two. And I dare you to prove me wrong on that, but I genuinely don't think you can prove that point that you can compare the two. So yeah. The VA is just it's not a good comparison.
Yeah, I mean, all hospitals are designated as they're oh my god, my words are just bad. Hospitals are designated as non-for-profit organizations. Oh my god, words are so hard for me.
Non-profit.
Yes, whatever. What
Non-profit.
Non-for-profit, yeah. And also all the hospitals that have had Medicare, they've been given the option to drop Medicare, but they won't because it would cut off profit for them. They're making money off of Medicare regardless of whether they do it or not.
Yeah, but on average, first of all, they're making a lot less money on Medicare. Maybe the payments are a little bit more timely. That's just because it's a government-run system. But the government bureaucracy in other states, based on the state, is very aged and it's not good. And obviously, another reason, and this I'm taking a morality argument here. Another reason that they're not dropping Medicare is because there's tons of low-income people, especially in urban areas, and older people maybe that rely on Medicare. So no hospital is just gonna be like, screw you old people, screw you poor people. We're not gonna take care of you. We're not gonna accept your Medicare. It's generally just the right thing to do. That's the main reason why they're not dropping Medicare. I'm willing to bet because the payments are genuinely not the same, and they never will be. The hospitals, if we go Medicare for all, will have to operate on a much lower budget with the same amount of liquid assets that they have to pay for and the same amount of resources that they're going to need because the population won't change. So if we go to Medicare for all and the hospitals have less resources, the population will remain the same. In the majority of the country, the population is going up. So, you're kind of screwed there. You're running out of resources. It's kind of like what they predicted would happen with coronavirus. The hospitals were going to be overflowed with people and no resources. That's exactly what would happen under the Medicare for all system.
Under what resources, though, would we run out of?
Well, so I made this point earlier, but when a hospital right now is running on a certain budget with the same amount of liquid assets, so they own all their property, their beds, their sheets, their cleaning supplies, they have to pay surgical assistants, nurses, doctors, administrative workers, legal workers, the list goes on and on. Well, when you're cutting, so on average, Medicare pays way less than private, maybe not even way less, but on average it pays less. So now the hospital, if everyone's on Medicare, is making less money in order to operate. So making money does not mean profit. Making money is enough money to operate, right? So if they're operating on a lower budget, that does not necessarily mean that the population of the city or region or rural area that they're serving decreases. In most of the country, the population's increasing. So when you're operating on lower resources and more people, inherently it doesn't work. It's basic supply and demand. It's a basic supply and demand concept here.
I mean, but we also do have the most amount of oncologists and specialists in the world. We have all these resources, but is there any study that you could name, a study showing that this wouldn't exactly be able to work due to our population?
Well, I'm not making the exact argument that it's based on population. I'm just saying that if the hospitals are making less money, inherently they're going to have less resources. So even if we have the most oncologists in the world, a lot of them are going to get fired. Let me pull up a statistic for you because I know you want some more elaboration.
I mean, and also they wouldn't I think you're arguing that they'd be getting paid less, but in most studies they've found that they wouldn't be getting paid less. The only people that would possibly be getting paid less are certain specialists.
Well, let me explain. The hospitals are the one getting paid, and the hospital distributes it among its specialists. But let me explain this to you. Advisory.com, kff.org, healthcaredive.com, khn.org, economics21.org. Private insurance pays hospitals on average 2 times more than Medicare. Okay, so now they're used to this double budget. You cut their budget in half. Either they're going to have to cut everyone's salary in half, which for nurses, it could put a lot of them into poverty. And even to the point where they can't survive. I don't think you want that. Or they're going to have to fire staff, cut their resources, cut their real estate, make the hospital smaller. So with a smaller hospital in a big city, and they're used to serving a specific size of a population, which seems to be increasing. It's simple, okay? If you're cutting the resources of the hospital, but the population remains the same, you're not going to get the same amount of care. You're going to get overflowed, and that's why we have wait times in countries like the UK and Canada. And I know that they have the queue system, but that doesn't really make a difference in this scenario. There's a reason why hospitals need to have certain budgets so they can operate and serve their communities best. So this brings me back. Why not go to a free market system so that they can modify in good time their budgets and make it efficient and lower costs for certain surgeries? Because if you're cutting out the insurance industries out of the pricing aspect, they're not taking as much of a portion of the cut. So they're actually making straight cash, the hospitals, but the insurance company will still cover portions of it. So why not do that? Doesn't that make more sense than firing a bunch of doctors, putting a bunch of nurses into poverty, putting a bunch of surgical assistants into poverty, getting rid of ventilators, hospital beds, and cleaning equipment?
I mean, but we would still have the need for these people. There would still be the need for them if they'd still be making the money.
Exactly. We still have a need for them, but they won't be able to be paid because guess what? The hospital is going to have to operate on half the budget if they're getting. So on average, Medicare pays half of what a private insurance company pays. So if the hospitals are making half the money, they're not going to be able to afford to keep the same amount of doctors and nurses and supplies on board. That is a simple concept to understand.
Audie, after this point, let Gabby have like a longer response.
Yeah.
You're talking a lot.
Yeah. Go ahead, Gabby. I'm actually done. I think I've done it. So.
Yeah, I mean, but also when we're talking about private insurance, they're basically gouging their customers. They're taking a large chunk of money from their customers, and that's not only just for actual care, it's for the actual overhead and payments and all these other things that people have to pay. If we take out these other options and these other overhead options that are going towards paying just the insurance company, then it's going to be more affordable because ultimately a lot of the money that is being paid isn't necessarily coming straight for the care. Well, it's factoring in also the overhead and all of those other factors.
Gabby, do you know why insurance companies have overhead?
Well, it's because they have to pay themselves.
Yes, it's because they have. Well, I mean, it's not even the bigwigs. There are thousands of low and mid-level workers in insurance companies. They have to get paid. But see, now this brings me back to why my option makes more sense here, is because, look, you are cutting the insurance company out of the pricing aspect. They're still getting a cut of it because they're going to pay. They're going to pay for that portion, whatever the person pays for their insurance, right? But you're cutting them out of the pricing process. So that way you can stop the price gouging, you can decrease prices and increase quality of care. And I think, Gabby, you are a genuine person. You care about people and you want to make sure that everybody has healthcare. Am I right in saying that?
Yes.
So good. That's great. I knew that. So that's amazing, right? So instead of Medicare for all, I encourage you to look into what the most logical solution would be. The government saves money because we know the government can't handle money. The quality of care increases. The prices on average decrease. The insurance companies can't gouge prices because they're cut out of the pricing process. And, we're getting away from the government spending fraud. And we cut out wait times and we really increase the quality of care. I think my solution is something that you would be on board with. I think for the sake of the debate, we both might not have as open of a mind to each other's options. But if you look logically, factually, and statistically, my solution historically has been proven to work where it's been used in certain cases. And Medicare for all has historically proven, maybe everyone gets healthcare, but they're screwed in the aspect of waiting times and quality of care, and the government has increased their debt and doubles their spending. But I think, Gabby, you could be part of a change in the leftist attitude where you realize that the free market system makes way more logical sense. And that yeah.
That sounded like a closing
I mean,
statement. Gabby, do you have like a closing statement you'd want to?
Join us, Gabby.
I think I know you guys are trying to get me to be a Republican again. I know, trying to get me back to my roots.
I haven't said anything.
I'm not trying to get you a Republican again.
It's okay. No, I'm just kidding. But no, I think we just disagree as to what is a free market and what we think is best for people, and as in like where we can cut money with Medicare and where we can improve aspects of Medicare. I think a lot of the things you've said like have aspects of Medicare within them, but ultimately I believe that because of the numerous amount of people that are dying due to lack of insurance or not having insurance at all, that having a public option that can be utilized by everyone for everything that we need as basic human beings is necessary. But that's my belief.
Yeah, no, I get that, and I respect your belief, and I appreciate that you also acknowledge that everyone should have health care. I personally don't think it's a human right, but I think it's something that everyone should have. And you said we both have different interpretations of the free market. That's not possible. The free market is the free market, and I think almost everything you said, almost every point you made, I think you're more of a free market capitalist than you might think in terms of I'm not asking you to be a Republican.
Stop.
But I'm just saying.
I've tried to red pillar 10,000 times. It doesn't work.
I'm not trying to red pillar. I'm just saying that, a lot of the points that were made actually support my points. But good stuff. Good stuff.
Gabby, do you have anything else that you would like to add?
I guess not. I guess not.
You sure? You sound like you're holding back something.
Yeah,
no.
Please share.
Well, I mean, I guess we just agree fundamentally where the free market lies within healthcare. Was like what I was saying. Like my idea is that people should be able to choose the hospital, choose the doctor they go to, and have free reign to do that. Whereas a little different.
Okay. Yeah. No, I respect that difference. I get that totally. Good stuff. This was a very good debate.
Yeah.
All right, guys.
Except for my internet issues.
Yeah, that's fine though.
All right, guys. I think that was good.
Yes, sir.
I think that finishes everything up.
Yeah.
Audie, you can end the stream if you want to.
All right, guys. Thank you guys for watching. Make sure you follow me at Political Bhanti, NickVideos, or the NickVideos, depending on the platform.
Me, bro. Hey, I gotta hey, this week on Friday, I'm dropping my merch line. I'm announcing it right here. I haven't announced it anywhere else. Y'all are the first people to know. I'm dropping my merch line on Friday. Y'all can get some awesome hoodies like this, t-shirts, everything else. Y'all already know what it is. These look clean.
Yes.
All right, Gabby.
Yes.
You gonna say bye?
Oh,
plug yourself.
Yeah. I'm GabiKatharina on TikTok and on YouTube. Follow me on both those things. Heck yeah.
All right, Bhanti, end the stream, sir.
All right, guys. I'm gonna end the stream.
Bet.
All right.